Let's talk about what are symptoms that people have that are early symptoms of ovarian cancer.
Please thank you so much for asking that question, because in years past it was miscategorized as a silent disease, that women had no symptoms, but that's not the case at all. We should educate our patients and ourselves about the symptoms and signs of ovarian cancer. They're vague, Bob. They are not, dramatic. Often fullness in the lower abdomen, pressure, sometimes frequent urination, frequent bowel movements, things of that nature that mimic other things like constipation and weight gain and getting older a little bit, those types of things. So they overlap.
Is there a common age that people have that people get ovarian cancer?
It is more common the older you get, and we do see it more in the 6th and 7th decade of life than we do but in earlier ages, but you can get ovarian cancer down in the teenage years as well. And we do treat a number of patients like that each year.
So symptoms of bloating and abdominal discomfort, that is a vague symptom. A lot of people get that. How do you hone in on if somebody just has vague fullness? Is it pelvic pain? Is it, frequent urination? Is it so many days a month? Tell me about it.
It could be any of those. Usually there's a combination of things. It's not just one thing like frequent urination. It may be pressure and urination frequency, or the bloating feel, or your clothes are changing. So here's the important part, is the symptoms don't resolve. We get constipation, we eat too much, we gain some weight over the holidays, we recognize it, we take laxatives or whatever, those go away. But when they persist, especially for 2 weeks or more, then you need to walk into your doctor and say, could I have ovarian cancer? Many times the doctor doesn't think about it. He or she is thinking about constipation, colon issues, dietary things, and may not even do a pelvic examination, which we just need to be on heightened alert for patients who have symptoms that don't resolve.